What's up, everybody? My name is Daniel Unmanageable, and welcome to Hard Knox Talks. Tonight's guest is the Managing Director for Push for Life Education and Training Services, based out of Southeastern Ontario. She spends her days raising awareness around safety and psychological health in the workplace. Allow me to introduce Corin. Hello, Corin.
Hi, Dan. Thanks so much for having me.
Thanks so much for being here. So, I understand back in the day, you were a first responder.
Absolutely. I have actually done a lot of first responding from a very young age, and then eventually worked my way into work as a paramedic for just shy of 10 years.
Interesting. So why on earth did you decide to dedicate your life to this cause?
Well, I guess, it's something that has always been a part of me to be in some form of education. And so when I was starting to think about a family and transitioning to other things, when it came time to make a decision about what to do in the interim of having young kids, I thought I would teach first aid for a time. And when I really thought about what that meant to me and how I wanted to deliver that, I felt like there was a really important piece that was being missed in the workplace, that we really termed this health and safety, and we were missing the well-being component. And so we started right away branding ourselves as health and well-being, and we started looking at the psychological impact of what was happening in the workplace, and from different angles, right? But from my work as a paramedic, I certainly can appreciate that when you're helping people in any kind of crisis, that there's impact, but as well that when we are supporting others in any capacity, that there's impact as well. And so, yeah, there's a lot of facets, but recognizing that there's a gap there, recognizing that there isn't a lot of voices talking about that, maybe the way that I like to. And I think the other component is maybe that I really love dispelling myths. I really love uncovering things for people and really talking about what the truth is beyond all of the superficial things that we maybe put out there.
So you're speaking like stigma reduction and things like that.
Yeah, for sure. Yeah, stigma reduction, but I think as well, we like a lot of feel good statements. And I think we put stuff out there that feels good, and then we don't really follow it through to its natural conclusion. We say things like get rid of the haters, in an effort to try and make ourselves happy. And, at the core, we're not really looking at why we're unhappy. If you're in a place where you are struggling with addiction, surrounding yourself with happy people is not going to change your state, right? You're still in a state of coping. There's an underlying challenge there. And so I think we do have to uncover those things. We have to recognize that mental health challenges in general are ones that we can't just sweep under the rug and surround ourselves with happy people, think happy thoughts, and they all sort of go away.
Yeah. So what kind of mental health challenges would you see in the workplace that you think psychological first aid would be of benefit to?
Well, what I really love about the psychological first aid program in particular is that it's so broad. It really is for everybody. And we have to understand that everybody expresses some sort of reaction to stress, and that we all cope. And sometimes we cope well, sometimes we're unsure. And certainly when we recognize that there are others around us who are coping, we don't always know how to approach that. And so this is a very scalable program. It has a huge component of self-care, and then it looks at how we care for others around us, how we recognize those signs of stress and crisis and trauma, and how we respond to them well in very practical ways. And so, recognizing that in the workplace, sometimes there is stuff that we bring from our lives to work, and sometimes work is what causes those things that are going on, and we need a way to respond to that well. And so I really do wish that there were more workplaces who were on board with this kind of training, supporting their workers to maintain a more healthy state and a better response to stress, but also taking some ownership, right? Like, I think probably doing what you're doing here, Dan, having these conversations, what you're talking about in part is where do employers get involved in these conversations? Where is their duty to support individuals who are impacted by addiction? And I would say that a large part of that is in the way of education, right? Like they're not experts to identify how they can support. And so how about we can just start right at the basics with how do we recognize signs of stress and crisis and trauma? If you're somebody who is affected by addiction, whether you're in recovery or not, you require support. And that can be day-to-day support, or that can be in a crisis. And we need to start to have that conversation.
Absolutely agreed. When I think of first aid, I think of an emergency. I think of someone chopped their finger off and they need immediate help. Maybe I attach that stigma to anything that I hear first, whenever I hear first aid. How does psychological first aid translate there? Like, is it teaching the employers skills to handle like a mental health crisis should one occur in their job or their workplace, or is it more of a soft skill?
Well, I think, there again, it's where it's a very broad program. It's recognizing that this is a scalable thing, that these things happen, not just in one way. And if I can clarify, you're not alone in your sort of identifying that first aid could be emergent. And I think when people are asked to do first aid training, that's often their first thought. Oh, I don't know if I want to practice CPR. I don't want to imagine somebody in that situation. And there's a bit of an aversion to that. But truly, the first aid program is about helping people identify, do I need 911 or not? Right? There might be times that you're able to manage a burn at home. There's still first aid procedures to follow, and there's still ways that we can mitigate infection, and we can look at some guidelines to tell us whether or not we need emergent care. Likewise, in psychological first aid, we talk about what types of connections we can make for people that will help them through a period of stress. And so those connections might be a behavior, in the sense that, if I'm experiencing an anxiety attack or a panic attack, there may be some things that we can do, in the way of some breathing exercises, or maybe going for a walk, or I could bring a coworker a warm beverage, right? These are all very practical actions that I can take to manage that in the interim as we're moving through this stressful period. But it may be emergent at times, and we can recognize that the resources that we need, or the connections we need to make, might be professional services. And so a lot of the program is case study based, and so it becomes very applicable to the group that's doing it in the way of developing a case study and responding to a particular situation. And as they go through that, they get to decide, who is impacted, because it might be more than one person. I'm sure you can appreciate, Dan, that if somebody in the workplace is going through some type of crisis, whether it's quietly, privately, or it's open in the workplace, there are other people who are affected by that, right? The people they're doing work with, the clients.
Yeah. That affects, it can affect the whole culture.
Exactly.
Absolutely.
So identifying, how do we approach these things? How do we have these conversations? I think a lot of it too is just like, are we allowed to have these conversations? So often in the workplace, we have, maybe human resources or some policy that says how we're allowed to contact people and what kinds of things we're allowed to talk about. There's a lot of privacy issues there. And so I think psychological first aid is a really great way to talk about, again, practical things we can do for somebody without breaching confidentiality or privacy challenges. And we can talk about what those might be.
Interesting. We were talking the other day, and you were talking about, first of all, let me go back for a sec. So who would receive this psychological first aid training? Is this like supervisor training, or does the company just delegate someone and you train them, one for each shift, or what does that look like?
Yeah.
And how long is it? Like how intense is it? Is it a couple of days or?
Two ways that people can get involved in the program. There are 2 online modules that people can take that are like a slideshow presentation that they would go through on their own to digest some information. And once they've done that, they're eligible for a 1-day in class to gain the full certification. And so we would call that a blended delivery. And the other way that they can engage with it is to do a full 2-day program. And that would give them the same certification. And so a psychological first aid certification is a 3-year certification. And truly the hope is that everyone will receive this training. I think it's a fabulous thing to implement at the manager level so that we have a starting point. I think culturally, that's a great way to implement this and then start to work down from there. But really, it's a resilience-based program. And the concept is the more people that have this training, ideally, the more resilient we are. If we practice these behaviors on a regular basis, if we find ways to manage our stress on a regular basis, we'll have sort of go-tos that work for us. And we know, right, tried and true. And so when something big happens, when something really impactful happens, we have some of those go-tos to rely on. And so as a company culture, when we're talking about in the workplace, we can start to develop these things, but also as a community to build resilience. We want to see more people trained within a community so that we can respond well to our own states of stress, but also to those around us who might require our support.
Yeah. So when we were talking the other day, we touched a little bit on the Canadian standard for psychological health and safety. And you said how it's beginning to be implemented in workplaces in your area. Tell us a little about that.
Yeah, I certainly see that there's a movement toward that. And I think that workplaces want to implement some well-being training. I think they recognize the need for it. Where I see that it sort of falls flat is that I think there's not a lot of direction. And so we have a lot of workplaces that reach out to us for either workshops, lunch and learns, or for psychological first aid training in an effort to get somebody to come in and make sense of what a well-being program might look like. There's so much out there, right? Some people think, oh, well-being, that must be yoga and meditation. And that's sort of where that conversation ends.
Not gonna lie, that's where my head goes. As soon as I hear well-being, that's what I think about. And whether that's right or wrong, who's to say? But you're right.
Sure, and that's a cultural thing, right? There's a bit of a fad right now around those things, and there's nothing wrong. Those certainly are a component of well-being. But if you did yoga every day, but neglected your diet and your sleep cycles and your financial well-being, you could be in quite a state. And I think those are the ones that get missed, right? These are the things that I often will talk to people about. Are you talking in the workplace about financial management? That if the reason you're not sleeping at night and the reason you're uncomfortable in your job is because you can't manage your finances, right? I don't know what to eat right now because I can't afford, or, I'm going out to McDonald's every day because I'm stressed out, but now I can't afford groceries at home. These are lifestyle management tools that are missing, right? We've been talking about how millennials have missed this, home economics and maybe they need adulting classes and, this kind of thing. The workplace, I think there's a real enlightening that's going on. Stuff is being uncovered that we have a real lack of skill when it comes to recognizing how to support our own well-being. And I think having a conversation around what balanced well-being is can be a significant help in the workplace. And you had really talked about, how employers can be supporting individuals who are in recovery. And I think, there's two aspects to that. And one of them is education and awareness. How can we help people to understand how to support themselves? Because there is a taking responsibility for your own disability or your own challenge that you're working through. But the other component is how to support an individual.
How to accommodate.
Accommodate is a good word, but I think there's a lot attached to it. But I think for employers, there is a cultural aspect to this. I think that if workplaces had the education piece, if they began to understand which stressors impact people's need to cope, right? When we're talking about work hours that go well beyond what we used to work, right? We're working more and more and more. And workplaces are having to downsize their number of employees and maybe pay them less. And so people are not just being paid less and working longer hours, but you might be doing 2 or 3 people's job. And under those circumstances, when we look at how businesses are run, when we look at the culture of moving fast and moving hard, there is something that we have sort of bought into. I think especially in certain industries more than others, but I can speak to paramedicine and first responders, that we buy into this, we're big and we're tough and we're strong and we're untouchable and we can go forever, and, these kinds of things. And, when you buy into that kind of identity, it can be difficult to step back from and admit that you're not all of those things, but that's what it takes to service your own well-being, right? We need to recognize, I can't work 14-hour shifts in a fashion that's unending. And we're in a place right now, at least in Ontario, where a number of paramedics are not in full-time permanent positions. And so they're working for multiple services, taking on as many hours as they can, just to kind of stay afloat. And, my ex-husband is a police officer, and sort of watching him, work long shifts and the demand and the expectation that you come at your best no matter what, regardless of what the impact is of what you've been doing. And then, it may be that you worked a night shift, but you have a court case that's at 6 a.m. And so you might get 2 or 3 hours sleep and off you go. Those kind of things put us in a state that is not terribly resilient. And so, of course we look for ways to cope. And if you have a predisposition to that, or if you have been somebody who gravitated toward addiction of any kind, right? In these places, we see a culture of sex addiction, not just drug use and substance abuse. And I think it makes sense, right? It makes sense, and we can connect the dots after the fact. But how do we start talking about this beforehand? How do we look at the prevention piece? Like you said, how do we look at the support and accommodations? To do that, we have to start talking about culture. We have to start thinking about industries like construction, where we take people away from their families for weeks on end and isolate them and put them in a place where we ask them to work long, hard hours in a very physical way, where they are left with chronic pain. And, what are you going to do to make yourself feel better in that state? How are you going to manage through those things? And so I think we drive addictive behaviors.
What do you think? And you're right. But what do you think about, how can I say this? Do you think improved legislation would help? Because I don't know about what's going on in Ontario with your provincial legislation, but I know here in Saskatchewan, the closest thing we come to dealing with impairment as it relates to intoxication in the workplace is Section 12 of the Occupational Health and Safety Regulations. And it says something to the effect of an employer has the responsibility to provide a safe workplace. Mm-hmm. And that is like, as far as impairment goes, that is as close as it gets to our holy grail. Mm-hmm. So we have to learn how to navigate within that, right? There's so much gray area that nobody really knows what to do. Mm-hmm. So what do you think? What do you think is a good jumping off point for that?
I do think legislation is helpful in this. It has moved the needle for things like sexual harassment in the workplace. We started with some education and awareness, and then it started to move the needle on behavior. And as people started to become aware of how it impacted culture, the buy-in happened. And where there's buy-in, then you start to see the needle move. So it certainly is an encouragement. Will it solve the problem? Not necessarily, right? There are still people who don't comply with regulations. There are still people who are lazy about it. Education can go in one ear and out the other. I talked to you about culture really has to start from the top down. You can have employees who are very passionate about this, but if they're not backed by the decision makers in a company, right? Of course, legislation is helpful, especially when we can implement something in the way of disciplinary action. But what I will say is, around addictions, our concept of disciplinary action is not always helpful.
Yeah, I say that nearly every episode. Is that we are treated based on the behavior. Today I was speaking with a friend, and we were talking about how an employer can approach someone that's struggling with substances, knowing full well that they're struggling with substances. But if the employee says, "I'm not struggling with substances," then the employee is in a place where they can be dismissed, and the employer, the person using substances could very well be in a place of insanity. So how can we fire someone who can't make a decision, who can't at a fundamental level tell the truth? Like, what do we do with that?
Yeah. And I can really appreciate from this side of the employer. So, I mean, they're not an addiction expert.
No, I agree.
They're not a mental health expert. And so there are some companies who maybe have somebody on staff to assist with identifying those things. And I certainly think the implementation of things like psychological first aid and mental health first aid can help us respond to these things better. But what we see in the way of legislation around other things, individuals who report mental health challenges or domestic violence, there is an onus on the employer to support the individual as they move through that. And I think that's great. But from an employer stance, how do you fill that spot while somebody's gone? And how do you keep a temp in there, and for how long? And, what if the temp ends up with a similar situation? Then you've got a backup for a backup. I think these are challenging things. I think it's great that we're having discussion around it, because that's how we find a solution, collaborative.
I wasn't trying to attack employers there, but I'm just trying to have a conversation about what can an employer do, because this person is struggling, and due to the nature of the illness, is seemingly incapable of telling the truth. How do we find a way to accommodate the employer and this person who's struggling?
Yeah, certainly. And I think, Daniel, that one of the things that I would say to an employer who maybe was having a conversation around psychological first aid, that when we talk about those connections, that connections can be a lot of different things. It can be helping somebody to reach out to resources in the way of counseling. It can be helping somebody reach out to someone in the way of a friend or a family member. It can be somebody who is a mentor or a pastor, right? And so that might be something that we can begin to recognize in the workplace, that if the employer is not the expert, that we have on hand some way of connecting individuals. So, there are EAP programs, and sometimes they're highly successful when people reach out and gain connections that way. But not every employer has that set in place. And I would say some EAP programs are really extensive in the way of ongoing education, and some are, simply a counselor who's on call. So, wide variety. But I think that that's a great place to start. When you're talking about somebody who might not be in the right state of mind to recognize what's going on for themselves or to make good decisions for themselves, perhaps helping them to connect with others and build relationship. That's something that I just really believe at the core core of who I am. It's not part of psychological first aid training or, any particular principle, but I really think to have impact on somebody, it often needs to be somebody who you have a relationship with, that you have a rapport with, that you trust, who maybe knows you to speak into those areas of your life. And so if we can provide connection for those individuals who are struggling, I think that that's a really great thing.
Yeah, and building rapport. I mean, in my studies over the past year, first as an addictions counselor and now as a safety professional, both of those fields talk heavily about building rapport, about knowing your client or your employee or the person you're working with, for a multitude of reasons. I'm trying to think of the name now off the top of my head. Referent power. It's basically people will listen to you and take your advice because they like you.
Sure.
Yeah. And not only that, if you have the ability to meet someone at their level, at the level that they're at, they're much more likely to be receptive to what you're going to say. And I think that's why people with lived experience in the mental health field are so valuable and are so needed right now, because they've been there, because I don't know how many times I've heard somebody say, you don't know what it's like, so coming from a place of experience, and you can say a few words and you can change a person's whole day around.
Yeah, absolutely. I am certainly somebody who believes in that line of thinking. I think it's one of the things that sets myself apart and my company apart from other first aid trainers, right?
With your first aid experience and your paramedic experience, surely you've been through some heavy situations.
Sure, and it looks different. But I think in the way of developing rapport, as you were speaking, I was just thinking about how many patients I've had who were in a state of overdose or who were really impacted by their addictions. And they do say that, right? You can't know. You can't be in my shoes. And I think developing rapport is a lot of earning the respect of the individual. And as a paramedic, you have to learn to do that quickly. You only have sometimes.
That's exactly right. That's exactly right.
And
sorry, go ahead.
You were talking about in social work, that's a big part of it is developing rapport. And so you'll know from that industry as well, any kind of social work or counseling or place where you're supporting a vulnerable person, we can only put ourselves in their shoes so much. Even if you've been through addiction and you're supporting somebody with addiction, yours is not the same as theirs. You're not them. And so, we develop rapport, and absolutely it's great if we can say, I have walked a mile in your shoes. But I think sometimes it's as valuable to say, I know I'm not you, and I know I can't identify with where you're at right in this moment. But, I'm here with you, and I'm not running away from this, and I'm not here to shame you in it. And, that might be part of that piece, right? When you talk about what can employers do, and I talk about the education piece, part of what I'm saying is when we come at this from a disciplinary action space, where we're talking about, I'm going to put you in a box or I'm going to remove you because you're uncomfortable and unsafe for the rest of us. We do have to put safeties in place, but I think that approach does not connect with the individual. It doesn't earn their respect, and it certainly doesn't put you in a place where the rapport is going to get you anywhere. Perhaps connecting with these individuals in a different way. It doesn't mean that we're always the person to walk them through that. I'm not a counselor, and I am not somebody who is going to walk the long road with somebody in that situation. But certainly, as a paramedic, we do sometimes see the same individual more than once. But aside from that, our time with these individuals is very short. And I think the impact, I've always come at it from a standpoint of knowing and understanding that I might not move a mountain at the moment, but that drop in the water, that little ripple effect that I've left in their life, maybe someday that'll hit the shore, and that will have impact in the long road. I think that's how we need to approach all of these situations. I'm not supporting an individual for me; it's for them, and so sometimes we have to do things that are practical. We have to do things that are evidence-based. We have to really get educated about what is productive and effective for these individuals, and then implement that and recognize, you made the comparison of psychological first aid to first aid, and I'll make another comparison. Sometimes we do CPR for a long time, and the person doesn't sit up and shake your hand and say, "Thanks for saving my life," in the middle of it. Sometimes you don't know whether or not they make it in the long run. But for those times that you do know that they made it, it's not in the moment, it's later. And I think we have to start to think about this that way. This is not a quick fix. This is not implement a policy and there it is. This is walking a long road with people, maybe recognizing we might just be making a drop, and hoping that ripple one day will hit the shore.
Yeah. So we've got a question coming in here from a viewer. Let's see. I'm sorry, my screen is very small. In psychological first aid, is there a portion set out for PTSD, even for coworkers? Like I think what she means is, as a coworker, is there a way to support someone, a fellow coworker, who's struggling with PTSD? And I'm assuming she's probably referring to in a first responders scenario or something similar.
Yeah, sure. There is certainly a recognition that post-traumatic stress disorder has a set of symptoms and some identifying factors. And I think, though, recognizing that most of us in the workplace are not professionals responding to that we are lay responders. It talks more about responding to specific signs of stress or distress in an individual, right? Somebody who is impacted by post-traumatic stress disorder will have some reaction in the moment that you're responding to. And so the Canadian Red Cross, it asks us to implement a look, listen, link, live process. And so a lot of it is looking to see what the individual is going through, what are some of the symptoms or tells of what they're experiencing, listening to what they're saying and telling us, and then responding to that by linking the individual to either behaviors or services that can be supportive in the moment.
Well, I hope that answered your question, Claudia. Let's see, what else do we got here? Let's talk a little bit more about workplace culture, and what are some of the things in Canadian workplaces that could inflame somebody's symptoms that's already struggling with mental health? What are the things that employers might be able to start thinking differently about?
Yeah, well, I think I've already talked a little bit about things like long work hours and being away from family and these kinds of things being impactful. And I don't think it's a stretch for most people. I think most people know and can identify what some of these things are. I think where it becomes difficult is people don't know how to solve that, right? Like, we have so much work to do. We can never get to the end of the list. How could we possibly change what we're doing? I would ask workplaces to start to think about how they could profit from shorter work weeks or shorter work days. And it doesn't have to be all the time, right? I've challenged some employers to say, could you end early one day a week, so that that's the day that your employees could choose to be involved in a hobby or a sport, or to go home early to their family and spend time with their kids. These connections to something physical that they're doing, whether it's going to the gym or playing a sport and what have you, can significantly help them to manage stress chemicals and mental health. Even if we're talking about, during the winter months, getting home before it's dark outside one day a week could really impact your well-being. Starting to talk about managing behaviors in the workplace in a way that is managing conflicts. I find so many workplaces sort of sweep things under the carpet, or if there is a behavior that's being dealt with, it's dealt with behind closed doors. And I think a lot of individuals can feel like maybe their hands are tied and they're unable to do something about difficulty or behaviors. Making sure that employees feel heard, these kinds of things that impact things like burnout. Can really, really help us to move forward and support individuals who are coping, right? A lot of the reasons we cope are because we're burnt out or we're moving in the direction of burnout.
So what are some of so you're talking about